This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh. We're just outside the surgery center where we're going to be speaking with Dr. Paul Fagan today. He's an orthopedic surgeon and we're talking about pain in the hip. You know, a lot of people put off getting that pain examined by a doctor because they're afraid I might need hip replacement, when in reality, a simple procedure many times can relieve that pain. Well, thank you for taking some time with us today. We're talking about problems with the hip, and when would a person start to experience problems where they figure, well, I've got to get something taken care of with this?
Well, often, commonly, we have patients that have pain in the hip, in the groin region, or sometimes they say the C sign, what we call it, where they say, gosh, my hip hurts right here. Other symptoms can include popping, clicking, or giving way.
Okay, and we've got our friend George here to help demonstrate where some of those issues might be as well. Are these problems developed, are they genetic problems? Is this something that can occur from an injury, or how do these things start to develop?
Actually, it's some of both. So some of the conditions are probably related to the way that your body is made to begin with, through the way that you develop and through some of the activities that you do. But it can also be through repetitive activities. A lot of times we see hip injuries in cyclists, runners, things of that nature. And it can also be from trauma, where you have a direct impact or injury to the hip.
Okay, so if a person is experiencing some pain or some popping, at what point should you get looked at? Or do you get looked at right away?
I would say that if it's something that bothers you on a day-to-day basis, or it's something that makes you limit your activities, especially if it's something that keeps you up at night, that's definitely when we would want to see you.
Okay,
Absolutely.
So what do you do to diagnose that a scope is necessary?
There are a number of things. One is we'd certainly see you in the office and perform a physical exam. A lot of the techniques that we use can, even just through a basic physical exam and talking with the patient about their history, can really lead us in the right direction of diagnosis. Once you are in the office, we'll also take some x-rays and look at some of the bony anatomy of your hip. So as we look on the skeleton here, a lot of pain from the hip is from what we call hip impingement or femoroacetabular impingement. And I know that's a big fancy word, but basically it's where two of the bones hit together. So when we look at your pelvis here, this is your upper thigh bone or the femur here. And then we look here at the hip joint. It's a ball and socket joint. And it's a nice round ball, and it fits into a cup in the pelvis. If there is some sort of bony mismatch, if there is an overhang of the cup, or there's a bone spur off the cup, and similarly, if there's a bone spur off of the ball on the femur, when you flex your hip up, for example, when you're sitting, or when you cross your legs over, this can pinch some of the soft tissue in between there, and those bones can hit each other and cause pain.
Okay, and I think a lot of people, when they think about hip pain, things like that, they immediately think, well, I need a hip replacement, but the scope is a less invasive way of handling that pain?
Absolutely. So hip scopes, although they've gained popularity in recent times, it's something that's been around for many years. Actually, the first time that a scope was put in a hip was in the 1930s. In the 80s and 90s, there were some pioneers in the field that began to put scopes in there, and they're doing it for more limited things, like if you had a loose piece of cartilage in your hip, or even just doing a debridement or cleaning up of damaged tissue. A lot of these conditions previously had to entail a large incision and a surgical hip dislocation in order to take care of those. Now, with hip arthroscopy and some of the special instruments we have, we can make a number of small incisions, about 1 centimeter or so in length, and use a small camera and specialized tools to manage the problems in there.
So if it is determined that somebody needs to have their hip scoped, so to say, what would surgery, that day of surgery look like?
It's an outpatient surgery.
Okay.
So you come in and you go home on the same day. We do a number of things to control pain, oral and IV medications. Anesthesia will sometimes put some medication to block some of the nerves to control pain postoperatively. The procedure itself usually takes around 2 hours or so, and then another hour or so in recovery, and you get to go home.
That's amazing. You're able to go home on the same day. What about the recovery time? Can I walk after a surgery like that?
Absolutely. People recover differently, and some of it depends on what type of procedure we perform. Typically, you're discharged home on crutches, so you're using that and putting some weight on your hip immediately. And typically, you're done with those between 2 and 4 weeks. Sort of depends on how fast you're progressing and what sort of conditions we had to address.
Okay, well, one of the things I always like to talk to the doctors about is, how do I avoid hip injuries or problems like that? Is there anything I can do to make sure my hips stay healthy?
Definitely. So I would say maintaining activity, right? If it's something that hurts you, we certainly need to see you, but we don't want anything to limit what you're doing. Maintaining an active, healthy lifestyle, we typically recommend non-impact activities. So running is cause a little bit more wear and tear on all of your joints, and non-impact activities like bicycling, even at the gym using an elliptical or swimming, activities like that are a little bit more friendly on your joints.
Yeah, and of course, the older we get, it seems like the more problems we run into, but you're seeing hip problems in younger patients as well, aren't you?
Absolutely, and that's why, when you ask about ways that we can prevent this, some of it is just the anatomy that you're born with, and we can't really control that, but this is certainly something that we see in teenagers throughout your life. However, once you get a little bit older, if you do develop arthritis or arthritic changes, unfortunately this is not the procedure for you. And we can't fix arthritis with a scope.
And that's probably when you're getting into the hip replacements.
Absolutely. That's when we start to talk about something along those lines. And some of the theory with this is also that if we address some of these problems when you're younger and before you develop those arthritic changes, that we can hopefully prevent you from getting that arthritis.
All right. Well, that's all very informative. We appreciate you taking some time with us today.
Absolutely. Thank you for having me.
If you've been experiencing pain in your hip or you have any questions about today's topic, you can always give Dr. Fagan a call here at Aurora at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.